Hello, this is Brianna Lagan, and I completed my VETS 203 preceptorship at Banfield Pet Hospital in Niskayuna. While there, I completed 137 hours over the course of 4 weeks. All Banfield Pet Hospital facilities are located within PetSmarts. My location specifically is located within the Mohawk Commons Shopping Center in Schenectady, New York. On this slide, I've gone ahead and listed the services that we offer at this location, and I put in bold those services that we perform more so on a daily basis. The layout of my facility specifically consists of a pharmacy, 4 exam rooms, there is a surgical suite, a back kennel for the dogs, a small 3-cage isolation room. We also have digital radiography equipment as well as dental radiography equipment now. We have a laundry room with mops and brooms. This is also where we store our autoclave and where our microscope and dyes are to perform fecals, urine stains, look at ear swabs, all that sort of stuff. In the main area, there is also one wet table for dental procedures. There are 2 exam tables out there, as well as a bench with supplies, a counter, and 3 computers for the doctors and the technicians to use. There is also an 11-cage wall for our surgery patients, so that way they can be visible for monitoring after pre-medication and after extubation. My facility had 3 doctors, one of which was my mentor. Unfortunately, my mentor did move away after my first preceptorship in the summer, but I do still love my new mentor. Her name is Dr. Perigine. She is from Rockland County, New York. She received her DVM degree from Ross University on the island of St. Kitts, and she loves soft tissue surgeries and dental cleanings. The other 2 veterinarians are Dr. Gomberg and Dr. Durham, both of which I also love to work with. I worked with Dr. Durham previously at a shelter for 2.5 years before coming and going to school in Delhi. There are 5 technicians currently working at my facility as well. Marianne, Jen, Dwight, Mandy, and Justine. Justine is the newest addition to our Banfield family. She was hired after my previous mentor moved away. Everyone there is super helpful, always answers my questions, shows me how to do things. I never feel pressure to do things I'm not ready for, but they also push me outside of my comfort zone. Jenna is the practice manager. She also helps as a VA sometimes when we're shorthanded. There are 2 CSCs, Ashley and Nancy, and 2 vet assistants, Stephanie and Kayla, who also help as CSCs sometimes. My role in the hospital was incredibly similar to the last time I was there. Right from the start, I was hands-on doing things. My day would start off coming in, helping collect samples, and run the diagnostic tests with blood, feces, urine, ear swabs. We'd start off with the surgery patients so that way we could get them going. I also helped prep patient charts and medical notes in our system. I prepared and administered vaccines, ordered and filled medications from the pharmacy. I would help admit and discharge patients. I also learned how to discuss optimal wellness plans, which is something Banfield specifically does. It's kind of like health insurance almost. So I would discuss those options with the clients. I helped obtain TPRs, mucous membranes, CRTs, in order to help prep patients for the doctors to come and look at them. I also helped clean kennels and cages and just overall maintained the general hospital cleanliness and organization. I cleaned surgical instruments, wrapped them, autoclaved them. I also folded and wrapped gowns. I would restrain animals for exam, collect samples myself. I gave pedicures, nail trims, and I also expressed anal glands. Really anything that they needed me to help with, I just jumped right in and did my best. And if I did something wrong, they were really good about letting me know how I could do it differently and improve. And I really appreciated all of those notes and really just being as hands-on as possible. I also was able to actually monitor anesthesia. I intubated patients. I would catheterize patients. I also performed a few dental cleanings, polishings, charted for dentals as well. So I got a lot of good hands-on practice with that. My first case study actually involves a personal family pet. His name is Skipper. He is a neutered male, 15 and a half years old, and he is a rat terrier. Skipper's case actually spans 3 separate visits and involves the diagnosis and treatment of a sialocele, a grade 5 heart murmur and mild cardiomegaly, stage 4 periodontal disease, and a raised erythematous growth on top of his head. His chief complaint at his most recent visit was that he was presented for blood work and thoracic radiographs to determine if he is healthy enough to undergo anesthesia for an extensive dental cleaning and possible mass removal. The following was found during Skipper's physical exam. He does have a body condition score of 6 out of 9, making him obese. Most of the findings were within normal limits, however, there were a few abnormalities. For instance, we have known for a while that he has nuclear sclerosis in both eyes. This is a stable chronic condition. We had known in the past that he had a heart murmur, however, it was much more mild than it is now. At these recent visits, it was diagnosed as a 5 out of 6 heart murmur. Integument assessment also found the raised erythematous growth on top of his head. And oral examination also found the sialocele on his right side, which we had examined at one of his first visits to the hospital. My family did elect not to proceed with sending any samples to a lab, as it didn't seem to be bothering him at the time. He also has 4 out of 4 tartar, 4 out of 4 dental calculus, 4 out of 4 gingivitis. His mouth is painful, and all of this led to the diagnosis of stage 4 periodontal disease. We are hoping that if we resolve the periodontal disease, then the sialocele will hopefully resolve as well, also possibly with some medication on board for that. But the doctors seem to think that it may be a secondary condition to the periodontal disease. Our plan of attack prior to getting his diagnostic results back was really just to assess the anesthetic risk of the patient, Skipper. To do this, we were going to run a CBC, IOF, and total T4 for blood work. We were also planning to take 3 views of thoracic radiographs to send out for a routine consult in order to assess diagnostic findings for Skipper's case. Luckily, his blood work all came back normal. The doctor didn't have any concerns. We also got his thoracic radiographs back from consult very quickly. The following are quotes from the consult report that they gave us. Their conclusion was that he has mild left-sided cardiomegaly, which is most likely secondary to mitral valvular endocarditis. There is no evidence of cardiac decompensation or failure. and the thorax is otherwise normal for patient's age and body habitus. Mild left side cardiomegaly is not necessarily a contraindication to general anesthesia, but utilization of anesthetic protocols which minimize risk to patients with compensated cardiac disease would likely be beneficial. They also went on to say that as tracheomalacia may be a possibility in this patient, careful monitoring during anesthetic extubation and recovery is most likely justified. With the results back from Skipper's blood work and x-ray consult, the DVM okayed moving forward with his dental cleaning and extraction scheduled in a month, which is, I believe, mid-February. We discussed with my mother, the client, that the growth on top of his head could and will also be removed at the time of the dental if it is still present and concerning. The DVM also prescribed 2 25 milligram tablets of pimobendan to be taken once a day leading up to the procedure, just to help support his heart through anesthesia. Lifelong use of the medication is also recommended, but she does understand that we may not be able to continue giving it after the procedure just because of the cost. My part in Skipper's case, besides just him being a family pet, is I helped restrain for his exam as well as his blood collection. I helped to position him and collimate for his thoracic radiographs. I ran the diagnostic blood work, and I also discussed with my mom, the client, the importance of dental care and prophylaxis, both for Skipper specifically and for our other pets at home, which I think really got through to her. So hopefully our other pets will have more consistent dental care in the future. Moving on now to my second case study. This is with a patient that I will refer to as Lucas. Lucas was admitted for a hospital stay after not eating, drinking, or passing a bowel movement in 48 hours. He remained under observation while being treated for constipation and dehydration until the issues resolved and he was discharged. Lucas was a 1-year-old Shih Tzu. He is a neutered male. His chief complaint was that he was presented for constipation. The patient had not passed a bowel movement for 48 hours. He had only urinated a little bit. In that time, he wasn't drinking, and he hadn't eaten a full meal in 48 hours as well. The owner reported that Lucas isn't known for eating things in the house. He only gets dog food, and there were no toys missing. Lucas's physical exam was overall unconcerning. He had a body condition score of 4 out of 9. Most of his assessments were within normal limits. During his oral exam, there was stage 1 tartar along the gum line. The real issue was when we took a look at his GI urogenital area. His abdomen was found to be tense, and the doctor found formed feces in his rectum. Diagnostic findings found that in his blood work presented with dehydration, and his internal organ function was normal. The plan for Lucas's stay was as follows. The DVM, upon initial exam, removed as much feces from the rectum as possible. We offered the patient water. He did drink some. We then also offered him AD food mixed with water, which he was not interested in. The DVM had the patient admitted for a hospital stay for observation and to administer subcutaneous fluids, an enema, and give famotidine, a famotidine injection to stimulate appetite. If the patient did not begin eating on his own, the plan was to syringe feed him some of the AD food in order to get his gut moving. After administering the enema, We gave a first round of fluids, the famotendin injection, and we did end up syringe feeding him. After this, the patient still had not passed a bowel movement. After 3 hours of waiting, the DVM then instructed another tech to take the patient outside to see if walking would get things moving. The patient did then successfully pass a bowel movement on the walk and was bathed and given a second round of subcutaneous fluids before being discharged. My part in his case was I was able to administer a disposable enema, which is pictured in the top right. I also gave him his 2 rounds of subcutaneous fluids, which was 100 milliliters of lactated ringer solution per round. So he received a total of 200 milliliters. We did syringe feed him 50 milliliters of the watered down AD. I administered 0.7 milliliters famotidine subcutaneously, and I also bathed the patient following his walk because he had gotten himself a bit messy. Overall, my time at Banfield's Niskayuna facility was an experience that I am incredibly grateful for the first time and the second time, considering everything that has happened the past year and a half. I was given ample opportunity to practice both my hands-on skills with patients and then those skills that are more client-based, such as talking on the phone, discharging patients, all of that. I would absolutely highly recommend Banfield as a preceptorship site for future students interested in small animal practice or just looking to hone their basic skills. Even through the slow days, the small everyday tasks, difficult patients or clients, and messes to clean, this experience was just added proof to myself that this is the career I am meant to follow. I would also like to note that following my first preceptorship over the summer, I was offered and accepted a position at this facility, and I do plan to work there after graduation as a VA and then as an LVT once I pass the VTNE. Last but certainly not least is my glossary of medical terms. To start us off, we have hyperthyroid, which is produced from excessive secretion of the thyroid hormones T3 and T4. It results in signs that reflect an increased metabolic rate, such as weight loss, despite a healthy appetite. This is most common in middle-aged to older cats, like the patient I saw, but it also develops rarely in dogs. Moving on to number 2 is hemangiosarcoma. This is an angiosarcoma originating in the blood vessels as opposed to lymphatic vessels. Angiosarcomas are arguably the most aggressive of all soft tissue tumors and are composed of cells that have many functional and morphologic features of normal endothelium. 3 is erythema or erythromatous growth. This is skin inflammation characterized by its redness in color on or around a raised growth. This we saw in my family's pet Skipper, like I mentioned in the case study I did on him. Number 4 is miliary dermatitis. This is classified as a cutaneous reaction pattern of inflammation and can be the manifestation of a wide variety of skin allergies, infections, or parasitic infestations. The majority of cases are associated with feline flea allergy dermatitis. This cat specifically that I got this term from presented with large areas of missing fur all over its body from excessive licking and scratching. Number 5 is probably the funniest and most ridiculous thing I've ever heard of. It is nudicles. I got this term when a client called to get an estimate for it, and me and the doctor I was working with that day had a good laugh. Basically, nudicles are prosthetic testicular implants for neutered dogs and other domestic animals meant to mimic the look and even feel of regular testicles. To quote the website that from the company that makes these, their purpose is to help neuter hesitant pet owners overcome the trauma of altering and allowing their beloved pet to retain its natural look and self-esteem. I really don't know what to say about nudicles except just why. Anyway, moving on to number 6, we have cobalamin deficiency, which is a B12 deficiency, which can lead to normocyclic, chromic, non-regenerative anemia. This was seen in one of my coworkers' dogs, Zeke, and he does receive B12 supplementation for this. Number 7 is PP or PPT, which is a platelet function test. This test, I saw it used as a differential diagnosis for possible Willebrand disease. Number 8 is Brucella canis, which is a bacterium that causes brucellosis in dogs. This bacterial infection is highly contagious between dogs and is a zoonotic disease. There is typically low risk of infection for pet owners, but a higher risk for veterinary professionals as it is spread through contact with all bodily fluids. Dogs with this illness can be infertile. It can lead to late-stage abortion in females, and it can lead to testicular atrophy in males. Pregnant women who may contract this disease are also at risk of abortion as well. So it's important to keep an eye out. We saw this in a dog that we had come in who was adopted from South America. Moving on to the last half of our words, number 9 is mammary carcinosarcoma. This is a cancerous mammary tumor consisting of both epithelial and connective tissues. Dogs, specifically intact bitches, are the most frequently affected domestic species, with about 50% of all tumors in bitches being mammary tumors. Number 10 is perineal urethrostomy, or PU. This is a surgical procedure that is commonly performed in male cats with frequent urinary obstruction. This procedure removes the narrowest part of the urethra by creating a new urinary opening that decreases the length of the urethra and allows urine to bypass this narrow region. We saw this in a cat that had gotten blocked 2, possibly 3 times in a single month. Number 11 is intestinal lymphadenectomy. I am not pronouncing that correctly. I apologize. It is a pathologic dilation of lymph vessels in the intestines. This disease is characterized by lymphatic vessel dilation, chronic diarrhea, and loss of proteins such as serum albumin and globulin. It is considered to be a chronic form of protein-losing enteropathy. Number 12 is cerebellar hypoplasia, which is a developmental condition in which the cerebellum of the brain fails to develop properly. The cerebellum is the portion of the brain that controls fine motor skills, balance, and coordination. It most commonly occurs when a pregnant cat becomes infected with feline panleukemia virus and passes the infection to her unborn kittens in utero. I helped perform the exam on a cat that came in with this. It was pretty sad. He absolutely had no idea which way was up. He was only a year old as well. Number 13 is MDR1, or multi-drug resistance mutation 1. This refers to a specific mutation that occurs at the gene known as the MDR1 gene, also known as the ABCB1 gene. Many herding breeds have this mutation, and it makes them more sensitive to the negative effects of certain antiparasitic agents when given at high doses. The anti-diarrheal agent known as Imodium, and several anti-cancer drugs. We saw this when we did a gene testing on one of our newest puppies that comes in. We do run gene testing on all of our new animals that are put on optimal wellness plans, just so that way we know if they have any sort of these sensitivities. Moving on to 14, dystocia. This is a simple one, but it does lead into our 15th term. Dystocia refers to abnormal or difficult birth. We had a dachshund come in that was pregnant. Unfortunately, it did end up getting referred to upstate veterinary specialties, I believe the hospital is called, because she was experiencing dystocia. This can be caused by maternal factors such as an inadequate size of the birth canal and or fetal factors like an oversized fetus, abnormal orientation, all sorts of that stuff. When Kiko, the dog, went in for this, they did find one puppy, unfortunately was deceased in the birth canal. They did try to induce her after, I believe, an hour and a half of no progress. They did perform a C-section and overhysterectomy. They found 3 puppies were alive. Unfortunately, 2 are only alive to this day, which is what leads us into our 15th and final term. Exomathalus, or Omphalocele, one of those 3 live babies, was born with this birth defect, which is a birth defect of the abdominal wall, in which the fetus's intestines, liver, or other organs stick outside of the body through the belly button and are covered in a thin, nearly transparent sac. Because the organs were born outside of the body, this pup was euthanized just because there really wasn't anything that we could do. Luckily, mom is okay, and the other 2 babies are still okay too.